Good morning, Commissioners. Thanks for having us. I'm Jason Renaud, and my friend here is Beckie Child. And Beckie and I are here today to speak about the safety of thousands of patients at the Unity Center and the dozens of other hospitals, clinics, alcohol and drug treatment centers, nursing homes, jails, daycare centers, schools, adult foster homes, residential care facilities, mental health treatment centers that assist vulnerable populations in Multnomah County. As best we can understand it, due to a miscommunication between county and state staff, few, if any, patient abuse investigations have occurred or been completed in Multnomah County in 2018. This miscommunication is unacceptable, and we commend the county's quick response to investigate the problem. In general, we trust licensed clinicians. They have education and training and experience and supervision and peer standing and legal responsibilities to guide their work. But counties add an additional layer of authority and reassurance by receiving complaints of patient abuse by mandatory reporters, thoroughly investigating the complaint, setting out the facts of the complaint, and making recommendations for future action. This sometimes tedious process provides an impartial and public accounting and resolution. It's the only layer of independent of the clinician and the agency that employs them. It's independent, it's authoritative, and it's impartial. The legal ability to investigate and force actions keeps patients safe and secure, knowing clinical services are a safe sanctuary of health and healing. But the message was received by the county to cease investigations, somehow. That alone should have set off sirens, not just a red flag, directly to your offices. It took dozens of messages from one alert employee and finally a dozen newspaper articles to get your attention and the commendable response.
So, good morning. So we have some recommendations. And
you need to state your name.
Oh, I'm sorry, Beckie Child.
Great, thanks.
Our recommendations are that all county agencies and personnel who interact with vulnerable populations identify a specific. There needs to be a process for reporting abuse. I also teach at the School of Social Work at Portland State, and I have a student who worked at Unity this year. And I asked her, it came up in conversation about abuse reporting. And she says, well, I'm just supposed to talk to my supervisor about it. She didn't have any idea that there were statutes that required her to report. And I said, well, what happens if your supervisor is the person you have to report? And she really didn't know what to do. That's not her fault. That tells me that we have a system that's not set up accurately. And so we have some recommendations for that. We believe that there's new administrative rules that just took effect August 15th. The state is working on trainings to get people trained in how to use those administrative rules. We recommend that all county employees who interact with vulnerable populations be trained, and the county commit to having everyone trained within a 6-month period of time, and then an annual refresher course.
And onboarding.
And onboarding for new employees. It just doesn't make any sense to me that this is not a regular systematic thing that happens. And then additionally, that in your contract language, that you require all of your contractors who interact with vulnerable employees.
And we talked to several of those this week, and it is a standard process there, but that should be mandatory.
So, and then the other thing I would just say is I use the redacted reports of abuse investigations to kind of check and see what's happening in our system. And I just can't tell you how alarmed I was when I asked for the abuse reports, the substantiated and inconclusive abuse reports from Unity from the time it opened until July of this year, and there was one that was not substantiated. And I know of several incidents that should have been reported. So I just would commend that you develop a policy and a procedure for making sure that this gets addressed quickly.
Thank you. Thanks so much for coming today.
Thank you.
Thank you.